Dr. Gary Bellman, so you had a PSA blood test and it was elevated, or there was a change went from lower to higher. So what do you need to do? You don't need a finger exam. You don't need a biopsy. You need a prostate MRI. An MRI is a non-invasive test to scan the prostate and check if there's any signs of cancer. So you get an MRI. How do you interpret the MRI? Well, there's a classification for the MRI called PI-RAD, P-I-R-A-D. It stands for Prostate Imaging, Reporting, and Data System. And there's 4 categories of the report. So you get a report, it's 2 pages, and in the end it says PI-RAD 2. PI-RAD 2 is normal. So if you have a PSA of 5 and you have a PI-RAD 2, it's normal. You don't need a biopsy. You just need to be monitored with an annual PSA. Then there's PI-RAD 3, 4, and 5. So PI-RAD 3 is equivocal, meaning there's some changes. Maybe a biopsy is appropriate, then you take the level of the PSA and make a decision. Sometimes you just monitor. PI-RAD 4 and 5 indicate that there's some spots in the prostate, and usually a targeted biopsy is appropriate, where they get the disc from the MRI and they go in through the backside in a 15-minute procedure, usually with light anesthetic, and biopsy those areas. So again, if you manage to get an annual PSA above the age of 45, if it's abnormal, don't worry, you don't need a digital rectal exam. You don't need a biopsy. You may need a biopsy, but first you get an MRI. And a lot of the times, PSAs are mildly elevated or even elevated, and the MRI says it's normal, a PI-RAD 2. It's not a guarantee, but most of the time, if you have a PI-RAD 2, you could avoid a biopsy and you just get an annual PSA. Again, PI-RAD 3 is equivocal. PI-RAD 4 or 5 have a decent chance of finding cancer, and you should have what's called a targeted biopsy.